Everybody just waiting to be live. All right, we are live. Welcome to Back Talks with Dr. Sean McWilliams. It is great to have you here. We are going to be talking about a really important subject called conquering spinal compression today, because it's one of the leading causes of degenerative disc disease and a leading cause of back pain for a lot of people. So I want to give you some great tips today on what you can do to reduce it or prevent it dramatically. Okay, so so glad to have you here. Hey, if you're with us for the first time, welcome. And it's we want to answer some questions for you. If you have questions, please say hello and let us know where you're from. And if it's your 100th time being here with us today on Wednesday, welcome back. So let's get into it. So conquering spinal compression and back pain. This is your guide to prevention and wellness. Well, what is spinal compression? It's a great question. A lot of people really don't know it. So let me show you the difference. So in this slide right here, you're going to see the difference between a MRI from the side of someone's back where there's really no spinal compression versus the other one that is spinal compression. So I'll blow this up a little bit for you so you can see a little bit better. And I'll just go over just a couple basics with you. So you're looking at a side view of someone's low back. Their belly button would be, up here, but further forward, just so you know. This area that comes down through here, this white area right there is where your cerebral spinal fluid flows through, and the spinal cord is this section right here, this dark gray area. So this is your spinal cord. And what the spinal cord does right around L2, L3 is it starts to tether off into what's called the cauda equina, and which means the horse's tail, if you're wondering what that term means. And you'll get these little gray pieces that come down right here, and those are called your traversing nerve branches. Those are actually the nerve branches when they branch off of the spinal cord. When they come off of the spinal cord here and they start branching off of the spinal cord, they branch, they come down and then out. That's the way that works, and that's what you're seeing right there. And the other thing that I want you to see is I want you to see the discs. So these structures right here where you see the D in the middle stands for a disc and disc. And when the discs are healthy, they should look like this for the most part without getting into too much information, okay, for you. Now I want you to look at the difference between these discs here and where there's spinal compression. So you can see this big black blob of disc material that has come out of the disc because the disc has herniated itself versus no big blob. So remember, the one on the right was pushing out like that you can see. And if you look at this, here's one of those traversing nerve branches, this gray thing that you see back there, and you can see that nuclear material is pushing right on that nerve branch. We don't want that because a lot of times that's going to lead to some pretty significant pain for you. So that's the difference between spinal compression and no spinal compression. Why is this important? Well, it's important because the less compression you have in the spine, the longer you're going to feel better. You're going to probably reduce or have no back pain in your life. And as you get older, you're going to have much higher success rate of your spine being really healthy. So if you got a mom or a dad and you watch them suffer with this stuff, sometimes a genetic component can be a big part of this. You're going to want to make sure that you keep your spine decompressed. And I'm going to show you how to do that today. So I thought I'd look some statistics up today. So this stuff is really fresh. And what this is I asked the question of, is there a study or statistic talking about a lifetime of compression in the spine and how it impacts the degeneration? Well, there hasn't been a lifelong study, but this one was pretty interesting though. This study shows a high prevalence of degenerational changes by age. By 60 years of age, over 90% of people will exhibit some evidence of disc degeneration, and a significant percentage will experience vertebral compression fractures. That's according to the Columbia University and National Institute of Health. You don't want that stuff. That stuff's nasty to deal with later on in life, so I want to help you prevent that. And if you are dealing with that, I want to also be able to help you as well, okay? So, hey Jamie, great to have you here. Welcome. I'm just reading your comment. Jamie, give me, so Jamie's dealing with some low back pain, stiffness that's been really bad, achy and worse in the evening, into the buttock, random knee swelling and ankle pain, pain in all my tendons and my left rib area. Hey Jamie, is there one area that's really bothering you the most? You can answer that way. We chat a little bit about this. You can put that in the comment for me, okay? I'm so sorry that you're having that to begin with, Jamie. That stuff is no fun. So by age 35, about 30% of people will have disc degeneration, and it increases dramatically to over 90% by age 60. All right, that's really important to know. By age 35, 30% of people. So, if you're in your 20s and 30s, this stuff is coming if you don't have a spinal hygiene program in place for yourself. So by age 35, 30% of people are going to have disc degeneration, and it's going to increase to over 90% by age 60, again, according to the Columbia University. That's a huge jump, and I don't want this happening to you. All right, and I'm sure you don't want it happening to yourself, so we want to make sure we put some things into place, and I'm going to give you my tips today on what to do to help reduce this or prevent it. Globally, with low back pain, 70 to 90% of people are expected to experience low back pain at some point in their life. And they're saying by the year 2015, so this is even old, this number is higher for sure, I know that, 540 million people will be affected by activity limiting low back pain. And that's according to the National Institute of Health. So those are big numbers, and I don't want you to be one of those numbers, all right? So what can you do about it? Well, one of the best things that we can do to prevent degenerative disc disease and spinal compression, like I showed you on the MRI, is to do the opposite of that, and that is to do home-based spinal traction. And what does home-based spinal traction do? Well, it looks like a machine that looks just like this. There is a specific way to do it to get the maximum benefit from it. But here's where a person has two belts around them, and it actually is going to traction out their spine. And what's it do? Well, when you take a spine that's compressed like this, you see in the red, and where those discs are being compressed, the disc is bulging out or herniated like you see like right through here. And what's that going to do? That's typically going to put pressure on these yellow nerves, and that's usually going to cause pain. So we want to do the opposite of that. And when I say opposite of that, we want to go over here. When you're on that type of device, you can elongate your spine, and you have to elongate it because remember, gravity, just gravity itself, is constantly compressing our bodies our whole life. And we don't want you getting shorter, and that's a common thing. People get in their 50s are like, wow, like my doctor said I lost my height. Well, they lost height because usually you're losing it in your discs, because 1/3 of the entire length of the spinal column is disc height. So 1/3 of the entire length of your spinal column, when you add them all up, is the height of the disc. So if you start getting degenerative disc disease and you start compressing the disc, you're going to get shorter. You don't want to be shorter, so we want to make sure that you stay like this. And so what this does when you're on those tables is this brings nutrition into the disc. It brings blood supply into the disc. It brings oxygen into the disc, and it helps the disc get rid of its waste products, which is super important, because if you don't do that, the disc can't stay healthy. It needs those oxygen and nutrition and water to stay healthy. And so traction at home is one of the best tools to really help you do that and prevent degenerative disc disease. And if you are having an issue with this, this is what we're trying to do. You're taking a bulge or herniated disc material that has come out because the disc has gotten damaged and putting pressure on this nerve and causing pain. And what we want to do is we want to help suck that disc material back in, like you're seeing right here. And then you want to go from that, as you continue to do that process, to start to get this disc to heal. And eventually, over a period of 15 to 24 months, get that disc to seal itself back up. And you can do this, believe it or not, from the comfort of your home with quite a high success rate. And it's very comfortable to do, and most people usually wind up loving it, and they get back to feeling great again. So I want you to know that it is possible, okay? So what else can you do? Well, let me give you a couple tips on this slide right here. Stretch your back and neck on a daily basis. If you're not sure what to do, you can go back. You can go into my regular YouTube channel, drshawnmcwilliams.com, and you can go and look, and I have some great videos on how to stretch your neck and your low back. So just follow those. It's going to help you a lot. I want you to do some basic core exercises if you feel up to it. And when I say basic core, I'm talking basic core. I'm not talking planks on your toes for a minute or 2 or 3 where your whole body's shaking. Very simple, basic exercises. If you're not sure what to do on those, we teach those on our Disc University course, so you can learn all about those there. I want you to set your workstation up correctly. If you go on to my YouTube channel, I shot 2 videos, they're on there, on how to get your workstation set up, how to adjust your chair properly, and how to get your workstation up. So you want that workstation up about your screen, about anywhere from about 3 to 8 degrees above your straight ahead vision. So you don't want to be just looking at straight, you want to be bringing back up a little bit like that, okay? Where that head's tilted slightly up from there. That's usually going to be the best setup for most people. And get your keyboard where it's proper right in front of you so you have a nice ergonomics. So go watch those 2 videos and they're going to explain everything you need to know about it, all right? You need to reduce some body weight. You know, 1 pound off of your body, 1 pound off your body is equal to 4 pounds off of your knees. Did you know that? That is a real thing. So my patients used to come in complaining a lot of knee pain. Jamie, I don't know where you're at with that, but just 1 pound off can make a significant difference in how you feel. So, you know, clean your diet up a little bit. Drink more water. You should be drinking half of your body weight in water per day. So make sure that you're doing that, okay? So if you weigh 100 pounds, you should be drinking 50 ounces of water a day. If you weigh 200 pounds, you should be drinking 100 ounces of water per day. And the best way to start that is before you put anything in your body whatsoever, this is when you get up in the morning for your Diet Coke or coffee or tea or whatever you like to drink water. First, it lubricates your digestive tract. It's going to stimulate a bowel movement to get rid of your waste products. Super important. So you're training your body on eliminating the waste products and getting it out, which is, you know, obviously, you know, paramount for keeping our bodies healthy. So drinking water first, and then if you want your tea or coffee, or if you're going to do soda, you know, then you can have that after that. But if you're drinking that stuff, you're going to need to drink more water. So just keep that in mind. If you are vaping, please stop vaping and smoking. Nicotine is one of the worst things you can do for your discs. Most surgeons, believe it or not, if you smoke, will not even do back surgery on you because they know that your success rate goes down so much. Why? Because there's so much less oxygen getting to your discs when people smoke and vape. And honestly, I think vaping is worse because they engineer those things to be so addictive that you're constantly putting nicotine in your body on a regular basis with that. So please stop that if you want to keep your spine healthy. And we already talked about hydrating with clean water. Try to stay away from tap water, please. It's usually going to have the most contaminants in it. So, you know, like a Brita filter is a good little step to go in the right direction, or the water coming out of your fridge. But I've tested all of those. I've done extensive testing on different types of water purification systems. The best that you can buy for a home is going to be a reverse osmosis unit. You can get something go underneath your sink, or you can get some countertop ones as well. I find the ones under the sink usually do a better job. The filters are bigger, they're more complex, but if you don't want to mess with that to begin with, you can get the countertop ones, and it's going to be way better than drinking tap water. And then just follow that rule of half your body weight, okay? What else can you do? Get your phone up, please. If you're with me, you know I'm like a broken record on this, especially with my kids. You gotta get your phone up. I don't care if you're sitting on the couch or if you're standing or whatever. You want to read a text, you want to respond to somebody, please, please, please get your phone up like this. Okay? Like this, people. All right? I do it all the time. Look at elbows on your chest, hold your phone like this, and you can type away, and it's a great posture for you. Versus, and this is me, by the way, I nuked myself to take those x-rays so you could see me holding my phone up like I just showed you. Here, proper way, check, yes, good. And what almost everybody else does. Looking down, please stop doing that and start doing this. Please, please, please. And your kids. And yes, you're going to sound like me, a broken record to your kids, but you got to set the example for them. And yeah, Marisa, so she installed a reverse osmosis under their sink this week, and You know, their water's super pure. Even our kids are super excited about it. And just think, you don't have to go to the store and buy bottles anymore. You're not using single-use plastics, which we know is so bad for our planet, and trying to reduce that. So there's so many benefits, and you could do that thing for like under $300. So if you live in a house and you're planning on staying there for at least a year, go invest in a reverse osmosis unit. You're going to be so glad you did. Trust me, I've been drinking reverse osmosis water for probably over 25 years now. So it's the purest water that you can drink. Okay. My kids aren't excited about holding their phones up instead of hunching over. Okay, well, they're probably already paying the price for that right now, and are going to pay an extreme price. And this is just isn't for Maurice's, but this is for everybody. I'm going to let you know, I take my kids to school. We're sitting there. I am on my kids all the time. Hold your phone up. 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 And I got to make sure I'm doing it too. And I try not using my phone, to be honest with you, a whole lot. You know, I got a nice Mac, so I can sit in front of that to do my work. But it is an epidemic going on right now, and there's going to be so many disc herniations and diseases in your children. And if you don't want to deal that with your children and start having your kids at 16 and 17 starting to have chronic neck pain and back pain, and by age 25 having radiation down to their shoulders, arms, hands, and fingers, weakness in their muscles, and dysfunction of their organs because there's been so much compression over the last 15 years or 10 years of their life, but because they kept their head down. If you don't want that, you got to get them to hold it up. And if you're not sure, go get an x-ray like I did, and I did the same thing on my kids to show them what they look like so they understand. Because remember, look at those stats. You know, we're looking at 30% of people at 35 with degenerative disc disease, and by the age you get into 50 and 60, going to 90%. Those numbers are going to be going down into the teens soon. I had last year, 2 years in my practice, 2 kids under 10 years old with herniated discs. Yes, it happens. People are shocked to hear that, but it is a real thing. And a lot of it is lifestyle, people. So you got to really be aware of it, okay? So please just be disciplined about it. Yeah, I love you and I love your kids, and even though I don't know them, but I want to see them healthy, and I want to see our globe and the people in our world to be healthier and not more sick as time goes on. Because when we're sick, life's not good, you know? You can have all the money in the world, and when you're sick, look at Steve Jobs, right? Had plenty of money and still just couldn't beat this disease and illness in his body. Well, there's no replacement for our spine yet, so you got to take care of the ones you got. What else do you need to know? Well, you need to know a little bit about posture and intradiscal pressure. You can go look at my lives. I've done lives just on this topic alone, but I'll just give you the cliff notes right now. So what you're looking at is you're looking at a chart of different positions and postures that people go into, and how much compression are taking place in their spine. And so when you look at this person right here who's laying on their back, that's 25 kilograms of compression through their low back. And what do I mean by compression? Well, I mean this. So here's our disc, and this is no compression into the disc. A little bit of compression is compression forward like this. A little bit more, a little bit more. So as that number goes up, this is what they're talking about that's happening on the inside of your body. And eventually to the point where when you don't prevent this from happening over a period of time, and you get more compression, more compression, more compression, and you break these rules of natural health, you're going to start getting typically bulging discs or herniated discs, and now you got a whole new issue to deal with, right? So I want to arm you with this information, because if you know it, then you can usually start to prevent things a lot. And there's Marisa, you know, saying, hey, your kids are already at 16 and 17, you know, already having back pain and neck pain. Yeah, it's a real thing. I've seen more back pain and neck pain in teenagers in the last 5 years than I've ever have in 25 years of practice, just so you know. And majority of it is because of being on their phones. So let's just wrap this chart up here, and so you can understand. So 25 kilograms of pressure when you're lying on your back. So if you're suffering with back pain right now, especially low back pain, typically you're going to be most comfortable lying on your back with your knees bent with some pillows underneath your knees. Now, if you go from lying on your back to laying on your side, it goes to 75 kilograms of pressure. If you stand like I am right now, I'm at 100 kilograms of pressure. If you sit in a chair leaning back, you're at 140. But look at what most people do when they're at work, right? They're doing this. They're sitting forward on their chair, not against the back of their chair, usually looking down at their keyboard and moving their body toward their screen. That's 275 kilograms of pressure in their low back. You're talking a lot of force, and you wonder why people start having back pain. So you have to know this and say, okay, I have to make changes to these postures to start to decrease the compression on my spine, which is what this whole talk was about today, is decreasing compression on the spine. And so you got to go into these postures where there's lower numbers, okay? So I hope that helps you a lot. Hey, if you're suffering with back pain or neck pain and you're not sure which direction to go, would love to talk with you. If you have images like x-rays or MRIs and you're not exactly sure what they're telling you, would love to look at those for you and go over those with you as well and help give you some guidance. You know, we worked really hard to create an amazing course so that you can take care of your spine and heal it from home. Yes, from your home without having to go to a doctor's office, make appointments, drive to appointments, co-pays, all that stuff. You get to do it from the comfort of your home, and I am your guide through that process to teach you how to do it. It's called Disc University. So would love to chat with you. If I think that Disc University would be a great fit for you to help you get back to the life you want, would love to share that with you. But before we do that, you know, if you need to go to somebody else, I'm going to help guide you do that, guide you as well, and make sure that we get you to the right person. But I am offering complimentary consultations right now to review or give you a second opinion on your x-rays or your MRIs and chat with you a little bit about what's going on and see if we can help you and guide you non-surgically. And if you would like to take advantage of that and apply for that, you can go to booking.drshawnmcwilliams.com, and there will be a calendar invite there that you can hop on. You'll learn a little bit about all the people that we help, and some cool testimonials on there as well. And you can click on it. You'll get onto my calendar. You'll see which days and times are available, and you just book one of those. And I will see you on a Zoom call. You'll fill out a form. You'll let me know everything that's going on about your back or your neck, so I'm aware of it. So we can, you know, have a real conversation. You don't have to explain all of that stuff to me. And we'd love to look at your images. You can email those to us as well. And let's see if we can shine some light on your situation for you and help you start feeling better ASAP. And let me tell you, it happens all the time. So I do it all the time with people. So I would like for you to be the next person who starts to have a smile on their face instead of a grimace on their face. Us helping you get rid of your back pain. So go to booking.drshawnmcwilliams.com. Take advantage of it. It's normally $197. I charge for that in my office. Right now I'm doing it complimentary because I just want to help you and help people around the world feel better and function better. So thanks for being with us today. It's always great having everybody here. Greatly appreciate you. If you have questions, you can direct message me, or what's even better, schedule a call with me. It's the best way, and we can sit down and chat for a few minutes, okay? And Jamie, if you have any issues, why don't you set a call up with me and stuff, and we can take a look at it and see if I can maybe connect some of the dots for you as well, and see if we can get you some help, okay? So you can go to booking.drshawnmcwilliams.com and hop on that and see if we can get you feeling better. All right, guys, hope you guys have an absolutely amazing rest of your day, and I'll see you next week.